Hello and welcome to this presentation of the University of Pennsylvania Postdoctoral Insurance Plan. My name is Dane Paisano. I'm the dedicated account manager for this benefit program. And today I'm just going to spend some time going through the benefit program with you, looking over the benefit options, how you enroll, some of the intricacies of coverage, etc. It's all information that will make you more familiar with your coverage, which in the long run can save you money and make sure that you have the plans and coverage that you need. Okay, moving on to the agenda for the presentation, we'll touch on who is Gallagher Benefit Services. So where does the company that I work for fit into the puzzle in terms of University of Pennsylvania and the benefits they offer postdocs. Second, we'll touch on the benefits actually offered through the postdoctoral insurance plan. We'll go through an overview of all of those plans that are offered in more detail. And then we'll go through an explanation of the enrollment process itself. So who is Gallagher Benefit Services? We are an insurance brokerage firm that works with universities to design, implement, and administer postdoc benefit programs nationwide. So essentially what you have available to you through the University of Pennsylvania Postdoc Insurance Plan, we do that for postdocs and universities all over the country. And it's basically our goal to provide you with all the support you need in order to make using your insurance and accessing care in the United States as simple as possible, because we know that it can be very complex and frustrating at times. So again, we're here to support you. At the end of this presentation, there will be contact information that you can use to contact us if we can be of any help to you with your benefits. Just a quick slide on the fact that we are also a distinguished partner of the National Postdoc Association, the NPA. I won't spend too much time on this slide, but we have been for a very long time, worked very closely with the NPA and are very proud to do so. It's a wonderful organization that takes great care in trying to improve benefits and just the overall postdoc situation for all postdocs all over the country. So what is open enrollment exactly? Well, open enrollment is an annual period of time that allows you to make changes to your benefits that you're not able to make throughout the rest of the year unless you experience what's called a qualifying event, or if you're a brand new postdoc. If you're a brand new postdoc, you have 31 days from your appointment start date to make changes to your plans. But once that 31 days is up, unless you experience one of these qualifying events below, you're only able to make changes to your coverage during open enrollment. Some examples of qualifying events are marriage, divorce, birth of a child, death of a dependent, adoption of a child, loss of coverage, dependent arrival in the United States, and dependent loss of eligibility due to turning age 26. Qualifying events are, again, events that allow you to make changes to your benefits outside of open enrollment, because if you're married in the middle of the year, obviously we don't want you having to wait until the beginning of the next year to add your new spouse. Or if your child's born, obviously, you need coverage right away for that child. You don't want to be waiting until open enrollment. And another big one is, for international postdocs, oftentimes dependents will arrive in the United States a month or 2 or 3 after the postdoc, and we don't want the postdoc having to enroll that dependent and then pay for coverage while the dependent isn't actually in the United States to use that coverage. So again, these are qualifying events that allow you to change your benefits outside of open enrollment. So here's a quick overview of all of the different plans available to you through the Penn Postdoc Insurance Plan. We have 2 medical plan options, both through Aetna. The HMO, which is referred to as the Health Network Only option, or the HNO, and then you have the PPO medical plan option as well. You have 2 dental plan options. You have a DMO, which is also an HMO dental plan, and then you have a DPPO dental plan as well. You have a vision insurance plan available to you, and then you also have a basic life and AD&D plan available to you as well through the standard. And we'll get into each of these plans in more detail in just a bit. Okay, so just a quick glossary of terms that I'd like to discuss before getting into the plan benefits, so that you're kind of aware of what the different words I'm using are referring to. So first off is the deductible. You typically only see these on PPO plans, but the deductible is basically the amount of money that must be paid by the insured yourself before the plan kicks in and you are subject to the co-insurance amounts. So essentially, think of the deductible as the amount that you have to pay up front when you need to access care before the plan benefits become active for you and take effect. Co-payments are fixed dollar amounts, for example, $15, that you would pay when accessing care. Now, again, you'll see an example of a co-payment when we go over the plans in just a minute, but just remember it's a fixed or flat dollar amount. Now, co-insurance, on the other hand, is a variable percentage that represents your share of the costs when you access care. So it's essentially a percentage of the billed amount that you're responsible for. So for example, if the hospital bill is $1,000 and your co-insurance is 10%, then your portion of that hospital bill would be $100. Again, this might be different if you haven't met your deductible, because if you remember, the deductible is what you have to pay up front before your co-insurance essentially kicks in. Your out-of-pocket maximum. Now, this is maybe the most important aspect of your insurance plan to understand and to look at when you're looking at plan options, not just now, but in the future as well. The out-of-pocket maximum is the maximum amount that you're going to be responsible for paying toward your care in a given plan year. Think of it as your overall safety net, so to speak. If you had something catastrophic happen to you, the out-of-pocket maximum is the most that you would be responsible for paying toward that catastrophic medical condition or illness or injury. And once you reach that amount, the insurance company pays for 100% of your costs through the end of the year. Now, that's your healthcare costs, not the cost of the plan itself, but your actual healthcare costs through the rest of the year. In-network providers, now this refers to a doctor or facility that has contracted with the insurance company, Aetna, to discount their fees for the services that they provide. So essentially, they have agreed via a contract with the insurance company to lower their fees, in essence, to kind of increase their patient traffic. Because when providers and facilities join an insurance network, obviously their patient flow is greatly increased since everybody has insurance and needs to use those networks. So long story short, using in-network providers is always going to keep your costs low or lower, because you're dealing with providers and facilities that have contracted with the insurance company and therefore have lower prices on their services. An out-of-network provider it's just the opposite. They have not agreed to contract with the insurance company. They're not in their network, and therefore, they haven't discounted their services, and you're going to end up paying more for those services out of network. Okay, so let's get into the medical insurance plan options. Again, those are provided by Aetna. So what is an Aetna Health Network only HMO plan? Well, an HMO plan typically requires you to choose a primary care physician that acts as your sort of healthcare gatekeeper that would refer you to specialists if necessary. That's typically how an HMO plan works. Now, the HMO plan offered through the Penn Postdoc Insurance Plan is special. It's considered an open access plan. And because of that, although the plan looks like an HMO plan in terms of, lower out-of-pocket costs, you do not have to choose a primary care physician. and you can self-refer to specialists without having to get that referral from a primary care physician. So it's kind of a best of both worlds situation. You have your lower out-of-pocket costs of an HMO plan structure, and then you sort of have a little bit of the freedom of a traditional PPO plan where you don't have to choose a primary care physician and you can self-refer. So you do want to keep in mind, however, that there is no out-of-network benefit on this plan, however. So although you don't have to choose a PCP or obtain referrals for specialist care, you do have to make sure that whatever provider or facility you are accessing care through is in the network. Otherwise, there will be no coverage for that visit. The one exception being if you were in a true life or limb, if there was a true imminent danger to your life or a limb, and it was a true emergency and you were in a ambulance being rushed to the nearest hospital, if that hospital is not in network, Aetna is not going to penalize you for that. Obviously, if it's a true emergency, you're going to be rushed to the nearest hospital regardless of its network status. And once they stabilize you, they'll transfer you to an in-network facility. But again, Aetna is not going to penalize you for that nearest hospital being out of network. So that's kind of the exception there. So here is a real high-level overview of the core benefits of the HMO plan. Now, there are much more detailed plan documents available through the benefit program website, which you can see there at the bottom is upenn.gpa.services. If you go into the plan documents library, you can find much more in-depth and detailed plan documents, but for the sake of the presentation today, we're just going to focus on the benefits that most postdocs are concerned about. So first off, we have this deductible. On the HMO plan, there is none. So there's no amount that you need to pay out of pocket up front before your plan kicks in for you. The plan is working as shown here from the first dollar you spend. Next, we have the out-of-pocket maximum for a single person and a family. So basically, if you remember from the previous slide, $1,500 is the most that you're going to spend out of your pocket toward your medical care in a plan year. Once you hit $1,500, the insurance company is going to pay for the remainder of your care for the rest of the year. And that is $3,000 for a family. So if you have dependents enrolled under your plan, each person meets their own $1,500 out-of-pocket maximum until you hit $3,000, and then the entire family is, the insurance company will pay for the entire family's out-of-pocket costs for the remainder of the year. Next, we have your office visit copays. You have a $20 copay for a general physician, and then a $30 copay for a specialist. Then you have your women's preventive health and just your general routine physical exams. Those are one per year, per calendar year, and those are at no cost to you. So it's highly recommended that you take advantage of just your routine physical exams and your women's preventive health exams each year. It's, again, no cost to you, and can help identify things early if anything is going on with your health. I do want to point out that with the routine physical exams, I've had postdocs that have scheduled routine exams. They go in, they speak to the doctor. After the routine exam is done, the doctor will ask, is there anything else, bothering you, or you have any, anything else you want to talk about? And a postdoc may mention, oh, well, I've had this pain in this joint, or I have this, sort of rash that I'm not sure what's going on about. And then the doctor is going to diagnose and treat that if they can, and then it no longer becomes a routine physical exam. It becomes a regular office exam, and they're going to charge you that copay. So I just want to make sure that postdocs are aware that a routine physical exam at no cost is truly just a wellness visit, not addressing any specific illness or injury. Next, we have your inpatient hospitalization copay. So if you go into the hospital and need to be hospitalized overnight, you're going to pay $250 per admission. That's not per day. So if your admission ends up being 3 days, 5 days, over a week, what have you, that $250 copay covers that admission. It's not per day. Next, you have your outpatient surgery copayment. That's a $100 copay per visit. Outpatient surgery is handled same day, so that's per visit. Next, you have your urgent care copay, which is $30. We'll get into urgent care a little bit more in a bit, but it's a great, urgent care facilities are a great alternative to trying to access care through a general physician, maybe same day. And it's certainly a better alternative to the emergency room if you're not quite in need of an ER visit. So we'll go over that again in just a bit. Speaking of the emergency room, it's a $75 copay if you go to the emergency room. If you end up being admitted to the hospital as a result of your visit to the ER, that $75 copay gets waived. And last but not least, we have your prescription drug copayment amounts here. $10 for a 30-day supply of generic drugs. Generic drugs are the drugs that have been around for a long time. There are a lot of different companies making these drugs. So there's a lot of supply and a lot of different options available to you. You have a $15 copay for your brand name drugs. So those are drugs that maybe only a few companies make, but so they're not quite as widespread. There aren't so many options, just a couple of brands. Maybe there are no generic options, so that's a $15 copay. And lastly, you have your specialty drugs at a $30 copay per month. So what is a PPO plan? Well, the PPO stands for Preferred Provider Organization. It has an in and out of network component, as you'll see in a second. Now, typically, the fact that you don't have to choose a PCP is specific to the PPO plan, but in your case, as we mentioned, is not specific to the PPO plan in your benefit program, because the HMO plan also does not require the choice of a PCP. However, the difference with this plan is there is an in and out of network component, as you'll see in just a few moments here. It's important to point out that the in-network benefits are greater than the out-of-network benefits. So while you do have the option of going out of network to access care, it's always going to be less out of your pocket if you manage to stick with in-network providers. So let's take a look at what this PPO plan looks like. So right off the bat, you can see a difference in terms of structure, not only in the fact that there's an out-of-network tier, but also that there are percentages and not just flat copayment amounts. Co-insurance are those percentages. So I'm going to focus on the in-network benefits now for the sake of this presentation, but you will notice the out-of-network benefits are not as good. The deductible is higher, the out-of-pocket maximum is higher, your co-insurance is higher, et cetera. So just keep that in mind when you're accessing care if you have the PPO plan. Going down the line of in-network benefits, this plan does have a deductible. So the HMO does not, but the PPO plan does. So again, that's the amount that you're going to pay up front when you access care before the plan kicks in and you start to receive the benefits of the flat copayment amounts or the co-insurance that the plan details here. So the individual deductible is $300. The family deductible caps at $900. Your out-of-pocket maximum as an individual is $2,500, and your out-of-pocket maximum as a family is $7,500. Your office visit for a general practitioner is $30, and for a specialist is $40. Just like the HMO plan, there is no cost for women's preventive health and routine physical exams. The PPO plan does have an e-visit option at a $30 copay. And as you can see below there, an e-visit is an online internet consultation between a physician and an established patient about a non-emergency healthcare matter. So you do have that option available to you as well. Your inpatient hospitalization Coinsurance is 20% after your deductible has been paid. So let's say that you had an accident and you needed to be hospitalized overnight, considering making it an inpatient hospitalization. First, you would pay $300 of the bill up front. Then after that $300, you're responsible for 20% of the hospital bill up to your out-of-pocket maximum of $2,500. So you can imagine how important that out-of-pocket maximum is on a PPO plan when, depending on how large the hospital bill is, when you're paying 20% of it, it could be fairly astronomical. So that's why it's that cap of $2,500 is important, and it protects you. Next, your outpatient surgery, again, 20% after your deductible. Urgent care copay on the PPO plan is $35. And your emergency room copay is $150. Again, that's waived if you're admitted to the hospital. And then your prescription drug benefit, it's a $20 copay for your generic, $30 for your brand name, and $50 for your specialty drugs. Okay, so here is a quick overview of sort of when and where you should access care. Because a lot of times, not just postdocs, but, everyone is not quite sure where they should go. There are many options in terms of facilities or providers. And so this is designed to sort of help you make an informed decision about where you should go to access care if you're not feeling well. First is the primary care physician. Can be chosen under the HMO plan, doesn't have to be. But, a primary care physician, you can also consider sort of a general physician. So these general physicians are great for your annual wellness exams, or if there's, moderate pain that you need diagnosed. They'll do general checkups and sort of help you identify a source of pain or illness and refer you to a specialist if they need to. A specialist is who you go to if you're experiencing pain to a specific region of your body. It's muscular pain, GI pain, bone pain, etc. There are specialists to help you with each of those different types of areas of your body. Next, we have the hospital. That's where you're going to go if you're having an inpatient or outpatient procedure, or if you're in a critical state and you're being rushed to the hospital. That's where you're going to be going in that ambulance, God forbid. Next, we have walk-in clinics. These are sort of freestanding facilities that are typically in retail locations such as Walgreens or CVS, and they can sort of treat very minor, non-urgent injuries and illnesses. They're used a lot for immunizations, but they are an option for those very minor cuts and abrasions maybe, and certainly for immunizations. Next, you have urgent care, which is an alternative to the emergency room. Now, urgent care centers are great because, if you wake up in the morning and, let's say you have a sinus infection, it's an acute sinus infection, you're in a lot of pain, and you call, all the general physicians in your area, nobody can see you same day, but you need help right away. Urgent care is the place to go. Now, most urgent care centers work that if you walk in, there's a sign-in sheet. You just write down your name and the time that you arrived, and they work their way down that list of people on a first-come, first-served basis, and have licensed physicians on staff to help you with whatever you're experiencing. If it's not something that's life-threatening or limb-threatening, urgent care centers are a great place to go for that. So keep that in mind. Now, the reason I say that is because with the emergency room, when you go to the emergency room, there is no, first come, first served basis. Everybody who goes into the emergency room is being triaged by nurses there to determine how severe their injuries are. And the severity of those injuries dictates the order in which those people are seen. So if you go into the emergency room with, sort of a cut finger that is bleeding a lot and needs stitches and needs immediate attention, but is not as severe as, these people who keep coming in with head trauma or heart attacks or, compound fractures or something of the sort that are more urgent. You could sit there all day long while these more severe cases are seen ahead of you. So it's really a good idea. Obviously, use the ER if it's necessary, but if it's not a real life or limb threatening situation, the urgent care center is definitely a place to consider because it can save you time and money. Okay, so with talk of all of these in-network and out-of-network providers, we want to make sure that you have the tools available to you to locate in-network and providers so that you are able to utilize those in-network benefits and make sure that who you're seeing is considered in-network. And for that reason, we have a Find a Provider link on the homepage of the dedicated website. It's that bottom right navigational tile. If you click on that, there's a PDF that pops up with step-by-step instructions on how to locate in-network providers for all of the different plan options available through the program. So just click on that, follow the step-by-step instructions for whatever plan you're trying to use, and you'll end up with a list of in-network providers that you can contact to access care. All right, summaries of benefits and coverage. These documents are fantastic. They are a result of the Affordable Care Act. And before the Affordable Care Act, insurance companies were not required to format their plan information into any one uniform structure. So that meant that every insurance company's benefit summaries and plan documents were a completely proprietary format. They were all different, and it made comparing plans across carriers and even within a single carrier very difficult because the benefits were all over the place. There was no given order, and it made finding the information and comparing the information very difficult. The Affordable Care Act mandated that insurance companies begin formatting all of their plans to this exact format that you see here. And so now all of the insurance companies have to put their plans in the same format, and it makes it very easy for people like you, postdocs and everyone to compare different plan options. You can go line by line and see how the plans differ in terms of their deductible, out-of-pocket maximum, co-payments, co-insurance, et cetera. So, they're very good in helping you make an informed decision about your healthcare needs. So if you're making, if you're debating changing plans this year, go into the plan documents library, pull up those summaries of benefits and coverage for the HMO and the PPO, maybe open them in different tabs, and then you can just go back and forth between the tabs and say, oh, the deductible is this on this plan, it's this on the other plan, et cetera, and, make the best decision for you and your family. Okay, so I sort of already went over this, but this is, again, just another slide advocating for urgent care, using urgent care over the emergency room as much as possible because, again, it saves you money and time, as I mentioned before, and as you can see here. And there are 7 urgent care centers within 10 miles of the UPenn campus, so there's no shortage of options available to you there. Again, we also went over the walk-in clinics on that previous slide. They are a great option if you just need an immunization or, have a minor cut or abrasion that requires some first aid. Certainly go ahead and use those walk-in clinics. And there are 5 walk-in clinics within 5 miles of campus going by zip code 19104. Okay, so mail order pharmacy. This is a program that is available through your Aetna medical plans that's designed to help curb the cost of medication for chronic conditions, or what they refer to as maintenance medications for things like asthma, arthritis, diabetes, high cholesterol, and heart conditions. That's what, those are included, but it's not limited to those. So essentially, what this mail order program does is it provides you with a 90-day supply of these medications at basically a 2-month copay. So your generic copay is normally $10 under the HMO plan for a 30-day supply. If you do mail order pharmacy, you're getting a 90-day supply for just $20. So it's essentially saving you that 3rd month of copay. And that continues for all tiers, $30 for brand name 90-day supply and $60 for non-formulary sort of specialty drugs as well. And the same goes for the PPO. You're essentially getting 90 days for the cost of 60 days if you sign up for the mail order pharmacy. 40 for generic, 60 for brand name, and 100 for non-formulary brand name. Now, to take advantage of this program, there is an Aetna RX home delivery order form in the plan documents library of the website. So if you're interested in this program, go ahead and take a look at that form, fill it out, and send it to Aetna to get this cost saving going for you. Wellness programs. So the Aetna medical plans, in addition to the benefits we've already gone over, include some wellness programs that are at no cost, no additional cost to you. They're all included in the medical plan itself. Now, I won't go over all of these in too much detail. There are much more detailed documents available on the website for these programs and many more that are available to you. So what I would recommend is just going into the plan documents library, looking in the wellness section, and just perusing the different flyers that are posted there to see if any of those programs are, something you're interested in, something that would be helpful for you. One thing I do want to focus on is Aetna Navigator. Now, Aetna Navigator is essentially the online member portal for all Aetna members. Now, this portal basically, allows you to print temporary ID cards, review your claims, use a provider directory that already has your plan loaded into it. There is a wealth of information in Aetna Navigator. All of it's useful. So if you haven't registered for Aetna Navigator yet, I highly recommend doing so. Okay, on to dental insurance. So the dental HMO plan, as you can see here, is very similar to a traditional HMO medical plan. Now, it's different from the Penn HMO medical plan because you don't have to choose a primary care physician for your HMO medical plan. Now, with the HMO dental plan, however, you do need to choose what's called a primary care dentist. Now, that primary care dentist is basically the general dentist that you must go to have your dental work done. And if you needed any sort of oral surgery or specialist, periodontal work done, that general dentist would then refer you out to that specialty dentist, and then you would have that work done. So that's an important thing to note. I do want to say that it's the protocol of this benefit program to assign all new postdocs to the Penn Dental School Clinic. So keep that in mind. The Penn Dental School Clinic was chosen as a sort of default for all new postdocs because a vast majority, 99% of new postdocs, were not choosing a primary care dentist. And that led to situations where they needed urgent dental work done, but they did not have a dentist that they were assigned to. So that created some problems. So we began auto-assigning to the Penn Dental School Clinic. You're not locked into the Penn Dental School Clinic. You can actually change your primary care dentist once a month all throughout the plan year. So, if you don't want to go to the dental school clinic or you went and had a bad experience, you're absolutely able to change to a different dental office. Again, you can do that once a month throughout the plan year. We just assigned to the Penn Dental School Clinic to make sure that everybody has somewhere to go if they have an urgent dental issue arise. Okay, so on to the benefits. There is no deductible on the HMO dental plan, so again, the plan starts working for you right away. Now we have this annual benefit maximum. Now that's different than the medical out-of-pocket maximum. The annual benefit maximum is the maximum amount that the insurance company will pay toward your dental care in a given plan year. Now, if you remember, the out-of-pocket maximum on the medical was the maximum amount that you would pay in a plan year. Now that we're moving on to dental, the benefit maximum, again, is the maximum amount that the insurance company will pay. Now, thankfully, on the HMO plan, it's unlimited, but as you'll see when we get to the PPO dental plan, it is not unlimited, so that's something to consider if you're looking at dental plan options. Moving on, we have your preventive or diagnostic care, dental care. That includes your routine exams, your teeth cleanings or what they'll refer to as prophylaxis, and your x-rays. Now this annual preventive care is at no charge to you. So definitely recommend taking advantage of these preventive services as soon as you can, and getting yourself established as a patient with your dental office so they can keep an eye on your dental health. I do want to point out one thing with teeth cleanings. I've had a lot of postdocs who have gone in for a routine teeth cleaning and expecting it to cost them nothing, as it should. However, what they received was not a routine cleaning, but a deep cleaning, which includes quite a bit more time and effort on behalf of the dental hygienist. So that is not covered as a routine cleaning. There is an additional charge associated with that deep cleaning. So just keep that in mind while you're, at the dentist office. If they say that they're recommending a deep cleaning and you agree to that, then there is going to be a charge associated with that. On that point, before I move on, it is highly recommended that you ask for what's called a pre-treatment estimate from your dental provider when you're accessing care. Essentially, they'll conduct their exam, and then based on what they found during the exam, they'll make their recommendations in terms of additional services you might need. At that time, they should provide you with a piece of paper that lists all of the services that they're recommending and the charges associated with those services. If they don't provide you with that, then ask them for it, because you should have the chance to review all of what they're recommending and what the costs are going to be before they actually do the work, and you're responsible for paying that. So make sure you ask for, again, it's called a pre-treatment estimate from your dental office after your exam if they don't volunteer that. Okay, moving on. For your basic procedures, you have these different co-payment amounts for fillings, endodontics, periodontics, oral surgery, et cetera. Now, the reason why we put varies up to a certain co-payment is because the HMO dental plan basically has what's called a patient charge schedule, which is a 5-page document that lists every single procedure that you can possibly have done under the HMO plan and the cost associated with that procedure. So as you can imagine, we can't fit 5 pages of codes and co-payments on a slide, so we have formatted it this way instead. But there is the full patient charge schedule or copay schedule available for you to review on the website under the plan documents library. So feel free to take a look at that at any time. You may even want to bring it to your dental visit so that you can check the pre-treatment estimate that I recommended you get against the patient charge schedule to make sure that all of those amounts are lining up as they should. Moving on, we have your major procedures, your crowns, bridge work, and dentures. And then there's also an orthodontia benefit for both adolescents and adults. It's still a significant cost for ortho, $1,945 plus startup and retention fees. So it's still a significant cost, but if you were an uninsured patient, that cost would be substantially higher. So, okay, and I already went over the kind of why we started assigning people to the Penn Dental School. Here's a little bit more information, but again, we recap that on the previous slide. Here's a bit of information on the Penn Dental School Clinic if you're not already aware. I won't go through each one of these, but at your convenience, these are just different features and benefits and accolades that the Penn Dental School Clinic has received over the years, and it's worth noting. Okay, so here is the Aetna Dental PPO plan. As you can see here, just like with the medical plan, it's got 2 tiers, in and out of network. So I'll just get right into the benefits. There is an annual deductible. There wasn't for the HMO dental, there is for the PPO. The deductible is $50 for an individual and $150 for a family. And now, very importantly, we have the annual benefit maximum of $1,500. So again, this is the most that the insurance company, Aetna, is going to pay toward your dental care in a given plan year. So essentially, once they pay $1,500 toward your dental care in terms of their cost sharing, they're not going to pay for any more of your dental work for the remainder of the year. So if you are coming up on 2022 knowing that you have a bunch of major dental work that you need done, then the PPO plan may not be the option for you, because if you're having a bunch of major work done, you're definitely going to hit that $1,500 mark, and then you're going to be on the hook for 100% after that. Whereas the HMO dental plan's unlimited in terms of your annual benefit maximum. So, an important thing to consider if you're wondering what dental plan you want for the new year. Now, onto the preventive diagnostic care. Again, that's covered at no cost to you, just like on the HMO dental plan. Then when you get into your basic procedures, you have a 20% coinsurance. So again, each one of those types of procedures, you're paying 20% of the bill. And Aetna is paying 80% of the bill up to their $1,500 annual benefit maximum. Then we get into major procedures, and you are responsible for 50% of the bill for those procedures. Last but not least, we have the orthodontia benefit. On the PPO plan, only children are eligible for the ortho benefit, and that benefit is 50% of the bill rate for the ortho care, and there is a $2,000 lifetime maximum on ortho. So Aetna's payment toward the orthodontia doesn't count toward your annual benefit maximum. It just counts toward this $2,000 lifetime maximum. So it's important to note that the ortho benefit is sort of a separate bucket than the annual benefit maximum. And you'll notice in the out-of-network tier of benefits, the coinsurance is a percentage of UCR. And we're going to get into what UCR means on the next slide here. So accessing the out-of-network tier on a PPO dental plan. This is just designed to kind of help you understand how accessing care out-of-network on the dental plan, the PPO dental plan, impacts your out-of-pocket costs. So for an example, an out-of-network example, there's an out-of-network dentist who charges $1,000 for a porcelain crown on your molar. Now, this dentist isn't prohibited from charging what they feel can be charged for the service, because they're, out of network. They're not in network. They're not contracted with Aetna to provide the service at a specific discounted rate. They can charge whatever they want. So your percentage of the cost out of network is 50% after your $50 deductible. And but the usual, customary, and reasonable charge for a crown is $800. Now, the usual, customary, and reasonable charge is what Aetna, the insurance company, dictates is a reasonable amount for a dentist to charge for that service based on their geographic location. So this dentist is charging $1,000. Well, Aetna says, well, that seems unreasonable. $800 is what the dentist should be charging for that crown in this area. Now, so doing this math, essentially, after your $50 deductible and paying 50% of what the UCR rate of $800 is, that's $425. Now, in addition to that $425, you owe the difference between what the UCR amount is and what the out-of-network dentist is actually charging you. So that would be $1,000, what the out-of-network dentist is charging, minus the 800, which is the UCR rate. So that leaves another $200. Now you take that $200 and you tack it right on to what you would have paid at an in-network dentist, leaving your out-of-pocket cost at $625. So this is just, again, I know it's a bit confusing, but its intention is to illustrate how accessing care out of network, even though the percentages might be the same in some areas, will impact your costs because you're going to a dentist that is not contracted with the insurance company, Aetna. All right, vision insurance. Now, vision insurance is pretty simple and straightforward. It is considered a PPO plan, so there is an in and out of network component. However, benefits are sort of lumped into three main categories. You have your eye exam, your frames, and your lenses or your contact lenses. And there are different copays associated with each of these different three sort of categories of benefits. So right off the bat, you have in-network, your eye exam, which you can get one every 12 months, is a $10 copayment. So you just pay that flat $10 for your exam. And out of network, you have a $40 allowance. So another instance of illustrating how out of network is going to cost you more out of pocket. A $40 allowance is not going to probably pay for even half of your exam with an optometrist. They're usually in the $80 to $90 range. So you're going to be responsible for that additional amount over the $40 that Aetna gives you, versus just paying a flat $10 for your visit. Next, you have your frames, which again you can get every 12 months. You have a $130 allowance in network versus a $45 allowance if you go out of network. Now, the way this frame allowance works is, it's basically money that you can put towards your frames. So let's say that you go to the optometrist, you find a pair of frames that you really like for, let's say, $120. Well, your allowance in network covers that. So you're not responsible for anything. You don't get the additional $10 that you didn't spend back, but you're not responsible for any cost of those frames. Let's say you go and you really want the $200 pair of designer frames that are more expensive. And you're still able to do that, but you're going to be responsible for the difference between the allowance and the cost of the frames. So in that example, you would be out of pocket $70 for those frames. Now, again, $45 out of network doesn't buy you a lot of frame. Next, we have the lenses, again, every 12 months. Regardless of whether they're single, bifocal, trifocal, or lenticular lenses in your glasses, it's a flat $25 copay for those lenses. And out of network, you can see, again, there are different allowances based on the type of lens, but it's going to end up costing you more out of pocket if you go that route. And last but not least, we have contact lenses. Now, contact lenses can be, the benefit here can be used in lieu of traditional lenses. So you have to either use a traditional lens or a contact lens benefit within that 12-month lens benefit period. So a lot of times a postdoc will update their traditional lenses for their glasses 1 year, and then, those are going to last quite a while. So unless, astigmatism changes. So then the next year they'll use their contact lens benefit of a $105 allowance. One last thing I want to point out about the vision plan is that the 12-month periods, it's not based on the calendar year, it's based on the date of service. So let's say that you go in on November 1st to have an eye exam done, you get new lenses for your new frames, and you use all three benefits on that date. You're going to be eligible to use those benefits again 12 months from November 1st. So you'd be eligible to use them again, November 1st of 2022, essentially. Again, because it's not based on the calendar year. All right, life and AD&D insurance provided by the standard. So AD&D stands for, it's not a pretty name, accidental death and dismemberment. So the life and AD&D plan will pay you $50,000, will not pay you, I apologize, will pay your beneficiaries $50,000 in the event of your death. An additional $50,000 is paid via the AD&D component if the death is due to an accident. So you could, your beneficiaries could receive up to $100,000 if it's an accidental death. It's also important to note that lumped into this life and AD&D plan is the medical evacuation and repatriation insurance necessary for all of you international J1 postdocs and your J2 dependents to keep you in compliance with the State Department. So you don't need to go looking elsewhere for supplemental medical evacuation and repatriation coverage. If you're concerned about that for your J1 and J2 status, that insurance is included in the life insurance plan for you and your J2 dependents. So it's an important aspect of the plan to keep in mind. And lastly, there is an accelerated benefit provision on the life insurance plan. So if, God forbid, you became terminally ill, you could receive an early allocation of up to 75% of your $50,000 benefit to help pay for any costs associated with that terminal illness. Okay, so on to the enrollment process. It's important to point out that the enrollment in the default plan, so your enrollment in the default plans, the HMO medical, the DMO dental, the vision, the life insurance, effective your appointment start date, those are all automatic. So as soon as we receive your information from the University of Pennsylvania as a new postdoc, we are automatically going to enroll you in these default plans effective your appointment start date. Now, you are able to waive out of these plans if you have alternate coverage, and you'll do so, via this process that we're about to go over now. It'll be another type of change that you can process in addition to changing plans, adding dependents, et cetera. So first off, you want to visit the Gallagher Benefit Services website via that link there and click on the login button at the top right corner of the screen. You'll register as a new user, entering your 8-digit PEN ID number and your date of birth. Once you've registered, that'll take you to the postdoc dashboard, and there you'll see a link to change My Benefit Selections. You'll go ahead and click that to make any changes that you desire. Now, it's highly recommended that you also add a life insurance beneficiary in Section 8 of the form. Life insurance is a benefit that you are entitled to by default under the Penn Postdoc program, and adding a beneficiary ensures that if, God forbid, something were to happen to you and that life insurance benefit was to be paid, there would be somebody that it could be paid to instead of going into probate, which is essentially an account that lawyers and whatnot can use to determine who is actually eligible for the life insurance benefit. And a lot of times, once the actual beneficiary is determined, the probate account has been significantly reduced, and a lot of that benefit has gone to waste just determining who should get the benefit. So it's very important to add a life insurance beneficiary. Now, all postdocs who are making changes to their default enrollment in that you're adding a dependent or you're buying up to the PPO medical or dental plans, if that's the case and your department has agreed to pay the additional cost of adding a dependent or buying up to one of the PPO or both of the PPO plans, it's really important that you work as soon as possible with your department administrator to complete and return to us a dependent contribution worksheet. This is essentially a document that authorizes us to bill the department for your dependent coverage or your buy-up coverage instead of you, the postdoc. This dependent contribution worksheet can be found in the plan documents library under miscellaneous. And again, please work with your business administrator to complete that form if they are paying the buy-up cost or for your dependents, and get that back to us as soon as possible so you aren't deducted in error. And if you do update your default benefits in any way, so if you add any dependents, waive any plans, change any plans, an electronic version of your updated enrollment form will be submitted to our secure database for processing whatever those changes are. Once we do process your initial enrollment, a welcome email will be sent to you as soon as your enrollment is processed, assuming you've entered an email address on your enrollment form, or we can locate your email in the Penn directory. ID cards will be mailed to your home address and typically take 7 to 10 business days to arrive. Once you get your ID card in the mail, you'll have the option of registering for Aetna Navigator. It's an online member portal that's extremely helpful. It provides you with a lot of information regarding your the status of any claims you may have pending, your last dates of service with a medical provider. It gives you access to an electronic copy of your ID card, which you can access at any time. So again, once you do receive that ID card in the mail, I highly recommend that you register for Aetna Navigator and have that portal at your fingertips for you. Okay, getting toward the end here, we just want to recap what constitutes an eligible family member if you're considering adding dependents to your plan this year. These family member eligibility requirements are the same as the faculty staff plans, so keep that in mind. These eligible dependents include a spouse, a natural or adopted child up to the age of 26. Stepchildren can also be included if they live with you and are supported more than 50% and claimed as a tax dependent. And then last but not least, same-sex domestic partners are also permitted. There is a declaration of domestic partnership form that needs to be completed on the website. However, those domestic partners, same-sex domestic partners, are eligible as well. All right, lastly here, we just have a contact information slide. We have the phone number for the benefit program website listed there, the email address associated with the benefit program, as well as, again, the URL for the direct dedicated website. Please use the phone number and email address to reach out to me directly. I'm happy to answer any questions that you have or help you through any frustrations you might be facing with your benefits. I really appreciate you taking the time to join me for this presentation today. I know insurance isn't the most exciting subject, but hopefully you've left today with a bit more information than you had before, and that will help serve you using your benefits and keeping your out-of-pocket costs low. Have a great rest of the day. And again, thank you for joining me.